Even in the best hands, adverse events can occur. Always consider that you could be the one having the complication. Probably the most frequent unpleasant result of rhinoplasty is a patient who is not happy with their result. Obviously, there are many factors that may lead to this problem. One may be a legitimate poor result. However, many times the patient's expectations are very unrealistic. Sometimes the degree of precision desired by the patient is simply not obtainable from modern plastic surgical techniques. Being able to wait while the swelling dissipates is very important to avoid a premature final judgment of your result. Sometimes revisions are necessary. However, sometimes even when a patient wants a revision, it is safest to leave well enough alone. Prolonged swelling, bruising, and healing can occur as with any surgery. Asymmetry of nasal features as well as the nostrils can occur as a result of surgery on the nose. However, many times asymmetry is present before surgery, but not recognized until after by the patient who examines their nose with more detail.
Here's an example of a person who has not had surgery and has uneven nostrils. Again, these differences from one side of your nose and face to the other are very common if you scrutinize them as closely before surgery as you will after. This is an example of a patient who has previously had a rhinoplasty. The cartilages of the tip of the nose are very asymmetric when comparing one side to the other, and there are prominent indentations present. In addition, you can see that support has been lost, causing collapse of the nostrils, which makes breathing more difficult. These are before and 15-month after photos of the same patient following her revision rhinoplasty. She had extensive cartilage grafting of her nose to provide better support, which in turn improved her breathing and provided a more appealing appearance.
Scarring is a necessary part of healing and accompanies all surgical procedures. Scarring worse than expected can occur from a variety of reasons. Sometimes incisions on the nose can be more noticeable than anticipated. It is important that you carefully follow your post-operative instructions. Numbness and pain at the surgical site is common after surgery. Although it is generally only temporary, it could continue indefinitely. Excessive bleeding or infection are risks associated with any surgical procedure, and the nose is no exception. Although unlikely, it could occur. A hematoma is an unexpected excessive collection of blood at the surgical site after surgery. These problems could require additional surgery to treat. Changes in the structure of the nose from surgery, trauma, or scarring can lead to changes in support. These can lead to breathing difficulties. Although some procedures are not intended to affect breathing, and others are intended to improve breathing, your breathing may not be improved and may even be worse after surgery. This is a photo of a patient's nostrils who, as a result of surgery and removal of cartilage, lost the necessary support for her left nostril. As a result, she has both a cosmetic deformity as well as difficulty breathing through her left nostril.
This is a photo taken of the inside of a patient's right nostril who had previously had a rhinoplasty and associated internal nasal surgery performed. Scar tissue has developed, which has almost totally occluded her nostril and airway on that side. Obviously, her breathing was worse than before the procedure. Generally, this particular problem can be corrected.
Sometimes nasal surgery, especially internally on the septum or turbinates, can result in problems such as excessive dryness or even a chronic runny nose. These can further add to breathing difficulties and may require medication to treat. A septal perforation is basically a hole in the septum in the inside of the nose, as shown here. These are sometimes seen in people who snort cocaine. This can occur as the result of surgery as well. This problem, along with other forms of scarring on the inside of the nose, can further restrict your breathing. If a septal perforation is present, surgical attempts can be made to correct it. Perforations can alter the flow of air through the nose and cause excessive dryness, crusting, as well as audible whistling. A saddle deformity is basically a collapse of your nose from loss of so much support. This can happen from extensive reduction or removal of tissues. It is fortunately rare, but certainly could lead to the need for additional surgery. If cartilage or tissues are removed from other sites such as the ear or rib, complications of wound healing can occur at those sites as well. Some of them include infection, bleeding, scarring, pain, deformities, or other problems. Be sure to ask your surgeon if he anticipates needing tissue from a site other than your nose. If cartilage grafts or synthetic implants are to be utilized during your nasal surgery, some special considerations exist. Any graft or implant could possibly become displaced over time. Both cartilage and synthetic implants may also become infected, requiring removal, and this appears to be more common with synthetic implants. Although unlikely, it could occur, and removal may require replacement of the graft or implant when the inflammation has resolved. Although rare, it is also possible for implants to even erode or come through the surface of the skin. This is called erosion and extrusion, and generally requires removal for an indefinite period of time. This is sometimes caused by excessive tension on the skin by the implant. It is more commonly seen with synthetic implants than from cartilage grafts. Grafts can also twist and become misshapen over time under the steady influence of scarring and contraction of the tissues. This appears to be more likely with cartilage. Be sure to ask your surgeon in detail about these possibilities. Any complications can result in deformities, both temporary and permanent. Revisional surgery is sometimes required after nasal surgery, and it generally becomes more difficult, unpredictable, and more risky each time. Be sure to be patient and obtain multiple consultations prior to considering revisional surgery. A very remote chance of change in sense of smell or a change in your voice could also occur, but is very unlikely. For those who make their living with the tone of their voice, such as singers and radio announcers, this potential risk should be discussed in detail. Although complications are unlikely, they do occur with any operations, and a rhinoplasty is a surgically sophisticated operation involving many variables. Other complications could occur and possibly lead to the need for hospitalization and even death. Be sure to carefully discuss these risks with your surgeon and the possible related financial responsibilities. Financial issues include procedural costs as well as lost work time. The time it takes for the surgical procedure, as well as the postoperative instructions, varies greatly among surgeons and should be discussed in your consultation. Rhinoplasty surgery is safely and frequently performed under both local and general anesthesia. With a general anesthesia, you are completely asleep and your breathing is controlled by the anesthesia provider. Under a local anesthesia, usually you are sedated, and the areas to be operated on are made numb with a series of injections. Although postoperative instructions vary among surgeons, the following are helpful suggestions. That being said, it is important, however, that you defer to and follow the instructions of your surgeon. Keep your head elevated at home during the early recovery period. Rotating frozen bags of peas make excellent ice packs. Some doctors place nasal packing or a splint inside the nose for a variable period of time. This is often useful as an internal splint to maintain position of the nose and modified structures during healing. Packing is helpful in decreasing any drainage of blood into the throat or stomach, which may be a nuisance and cause nausea. It will, however, lead to a dry throat until it is removed, as you will have to breathe through your mouth. Ice chips, lozenges, and popsicles are helpful in keeping the throat moist. You should not probe inside your nose or blow your nose for about a month, and try to direct sneezing out of your mouth. Vigorous activity should be discouraged that would raise your blood pressure, such as exercise, for about a month after surgery. If a splint is placed, it is likely to be on for about a week. It is important to know that if you were to break your arm, a splint or cast would be in place for 6 weeks to allow complete healing. A splint or cast cannot be kept on your nose for 6 weeks, so it's important during that time that you do not bump or bend your nose, which could adversely affect the final shape and position of your nose. To have the best chance at an optimal outcome, it is very important that you follow your surgeon's instructions carefully. Show up for all your postoperative appointments. This gives your surgeon and his staff the opportunity to evaluate your healing and detect early problems if present. The recovery period also varies greatly depending on the technique, surgeon, and patient. Usually, bruising, if present, should be gone within 5 to 10 days. Although your nose will be swollen, you are generally presentable for work after the splint is removed. It has to be emphasized that in most cases when the splint comes off, you will see a nice improvement in your nose, but not to the extent that you would like. You must be patient during the healing period and know your final result will likely not be identifiable for 1 year. Pictures at 1 week, 6 months, and 1 year after surgery will show a progressive change.
The next video segment follows the pre- and post-operative course of a patient who will undergo a rhinoplasty.